as I earlier shared, we also a research-based organization, and we've been conducting researches. We have a number of research out there by the government, by other organizations. But even as an organization, we usually conduct studies so as to support us to know how best we will support these children. As we all know, some of these presentations given out or published by the government, they are for the national level, but we need to bring them out to the grassroots level so that the intervention in this region can be unique, or the issue of street children in this region can be unique compared to those other. And we conducted research for 227 street involved children indeed. I'll be taking you through the presentation, and we came to realize that first let me share with you about the two surveys that are out in public for that address issues to do with street children. The first one is the Violence Against Children Survey of 2019, and also the National Census on Street Families for 2018. They are really a good report out there, but we came to realize that they only address the issue of a child. And what we came to realize is that matters to do with children should not be viewed in one perspective only, but it's more of an ecology level, whereby we start with the child level, what is affecting this child that is coming to the street. For example, in case of child abuse or malnutrition or maltreatment or child labor. As a program, we have interventions on how we can support us as a program working with the street children. In case it's microsystem level, at the functional levels, we have all those drivers, be it family functioning, child maltreatment, food and housing security, peer pressure, intimate partner violence, and substance abuse. Between the family levels, we have parenting system support, we have intervention under our program, at the community level, at the national level, and at the global level. So we feel that it's about when we view the issue that these children, the factors that are making these children to come out of their family or migrate from their family and community to the streets, we do all those dimensions rather than viewing it from one dimension at the child level. So from our presentation, these are some of the findings. We came to the first figure. It's the time on the street and the substance induced. Between the first month to the 10 months, you can see the curve. Children do not abuse drugs that much, but as they continue to stay in the street, they continue using those drugs. In Kenya, they use 7 stars, the sniffing blues, and other drugs like the spirits and cigarettes. The other figure, it's on abuses that these children face. The one in a blue curve, it's on the sexual abuse. You can see them at first. There are cases of sexual abuse, and there's even boys in the streets, they face sexual abuse. They are sodomized in the streets. They are sexually assaulted in the streets. And as you can see, after the 30 to 50 months, the curve is going down because the boy has stayed in the street and he has security, so no one can really abuse him that much. But for these other the economic abuse, the children face economic abuse, where they are given, they are used for cheap labor, emotional abuse, and physical abuse. Really, these children in the street, they really face physical abuse. The other presentation is on drivers of street family migration at the family level. We saw that The first figure, as a result of positivity emotion, where the family are not positively emotional well, the children tend to go to the streets. Curiosity, social curiosity, they still, if the community does not have good social curiosity, they end up to the streets. In case the family is depressed or there's emotional abuse within the caregivers, children may end up to the streets. In case of childhood experience, those are the figures. Still, these are at family level, where we think that let us not use well or food security as the only determinants or drivers that are making children to go to the streets. That one is at community level. As a shared review, we have community groups within that main regions in Meru County, and during the study we came to realize that 7 communities did not report. A number of people do not report when the children go to the streets. So there is no reporting mechanism whereby the community is not informed on how to report in case the child has lost or has migrated to the streets. But rather, most of them keep quiet. And especially in area, children are really used in Mora business. The parent could be seeing the son each and every day going to pluck Mora. So somehow is negligent by the parents. So those are the findings from the children. We have cases whereby a number of children that we support really relapse back to the community, relapse, and others at our center, there is some escape to the center. And then the chart is whereby we integrate children back to the family. This is our integration success rate. For the KPD as a shared it's Kuja Pamoja kwa Jamii, it's a community program that supports these children to sustain in the family. As you can see, when we integrate these children whose parents are in KPJ or the community program, they really work well in the community. They sustain, or it's sustainable for them to reintegrate well in the community. We also place or integrate children in boarding school or polytechnic schools, and still as a shared we do, we sometimes some of our boys relapse because ensuring the successfulness of a child staying well in the family, it calls a number of parties, including us as an NGO, the government, and the school. We are now in a digital era. We are now in a digital world, and as an organization, we so much meet with children during street outreach in the streets. And as I earlier shared, we not every time that we rescue or we rehabilitate them, but we have engagement with them. So we are currently developing a tool which was adopted from United States. It's called Community Health Integrated Response Portal. This is whereby we have the information of those children. Then from those information, I think most of you know, as you can see, there's a map of Meru County. I believe most of you know about heat maps, whereby in case we have a location A, and this is the number of children coming from that location A, and we are able to identify the reason they are coming from that location, we input those information. Once inputting that information, it will be saved on this digital tool. And once it's saved on digital tool, the stakeholders in place at that region will be able to identify the reason why the children are coming from that region, and they will come up with their own interventions based at that community level. So this is a tool that we are trying to develop, but we are hoping we'll be able to finish upon getting some more funding. That's why we enter the data, we enable the community make decisions, and then they change. I'm finishing up. So these are recommendations. The first one, it's on the VAC. As Yala shared, the VAC report, it's majorly focused on children. But it's about when we categorize these children especially. So we are requesting that they register a prevalence of child migration among households. The next, in case there's a next VAC report next time, it's about what about you intervene the street involved children who are in the street. The street family rehabilitation trust fund. There's a street family rehabilitation policy which is not yet finalized, or it's not yet finalized. We are requesting that the street family rehabilitation fund finalize the street family rehabilitation fund. On the national strategy, we are seeking. It's about when we take serious and leases to the government. It's about when we come up with legal framework that majorly, or we enact a law that will address the needs of street people or street persons, so that they will be able to give mandate both to the national government and to the county government, because currently matters to do with street children and street families, it's at the national level. But I'm happy to report that currently the Street Family Rehabilitation Trust Fund, it's coming to the village level, and to our own work, we are looking forward to finishing up with the chip or the digital tool, but it's upon getting more funding. Thank you.
Thank you very much.
Next page. In case you need to get some of our research, it's on those QR codes. Thank you.
A clap for Calvin. Is there any question? I can see 1, 2. So because of time, we'll just give those 2. Yes, sir.
Thank you so much. Allow me to begin by appreciating the 4R plus P model. To me, it has come as a challenge. And one thing that has evoked my question that I want to ask, or rather just a concern. I come from Kakamega, and at one point, I saw some people come to Kakamega, and then they interact with the street children, and then they had a good time with them and even had meals with them. But now my concern is, after the meals, then they left the children to go back to the streets. Do you think it's good advice that we can take back, that instead of such approaches they were using, instead to try and adopt the 4R plus P model? Then lastly, being a good model the way it is, how ready are you to work with other counties to ensure that they also adopt it and they help street children across the country? Thank you.
Thank you very much for the wonderful presentation. My name is Alex. I work with Africhard Center in Uganda. My question is on the third R. I don't know whether the integration.
Integration, yes.
Yeah, I want to understand, especially for children who are interested in leaving the streets to go back to families, but they don't have biological families or kinship. How is the foster care trying to work out for them? Thank you.
So Calvin, you have 2 minutes to respond.
Thanks so much. Let me say the simplest way to train big children together is through meals or those handouts, but it's not sustainable. You can't keep on feeding them each and every time. The importance of our 4R, as I shared with you, the first bit is rescue, whereby we conduct street outreach. Street outreach, it's not once, it's not twice. And not a number of you have worked with street children before. Working with street children calls for patience. So bringing food sometimes encourages children coming to the streets because they know they will get some meals. But we are a model, we conduct rescue street outreach over and over. We come to this town the first time, the second time, because we need to build a rapport. And building a rapport is not do the meals. The other one is how ready are we to work with the county. It's our call because as an organization, as an NGO, our major mandate or our major goal is to complement their work, to complement the work of the government. We work well with the Meru County, we work well with the Isiolo County. We look forward to extending to the other counties, especially now that the Street Family Rehabilitation Trust Fund is coming to the county levels. We look forward to working with them. On the other hand, on integration, there are those children that one way or another, either they are total orphan, and during the rehabilitation bit, we look at the best option. Is it foster care? Is it guardianship? Is it placing them or supporting child-ended family or independent living? Because there are those older boys that we can't place them under foster care, but we consider paying some rent, or we'll consider supporting them too. We'll consider supporting independent living for them to continue as they continue either with the school or the polytechnics. So there are a number of options which are based on the recommendation by either the social workers or the family, because we believe as an organization, our major goal is to facilitate and make decision based on the family and as an organization and the government, you making the decision which best for each and every child. Yes.
So thank you very much. Thank you very much, Moses. A big clap for Moses, can we, as he exits the stage. So our next presenter is from Investing in Children and Their Societies, Mr. Dennis Kisao. Mr. Dennis is the Positive Parenting Project Coordinator in the organization. ICSSP is an innovative African NGO that works in rural areas of Africa, together with families and communities, to ensure that they end violence against children. So today, Dennis will talk to us about gender transformative skillful parenting programs to address child maltreatment and intimate partner violence in low resource settings in Kenya. Karibu sana, Dennis.
Thank you very much for that wonderful presentation. And I think you've already introduced our organization, so I'll just delve in. Kindly put up. Okay, this has already been said that we are an organization that works with partners and stakeholders, facilitating them to provide safe and nurturing family environments for children. So what I'm here to present today is our Gender Transformative Skillful Parenting Program, which is a promising pathway to preventing both child maltreatment and intimate partner violence, especially in low-resource settings in Kenya. The Skillful Parenting Program seeks to improve how parents approach and undertake their parenting duties, especially looking at their parenting knowledge, their parenting skills, their behaviors, but most importantly, their practices, the parenting practices. And this will be on the backdrop of the intersectionality between violence against children and violence against women, which is something that has been talked about at length in the morning by the keynote speakers. So for us, we are facilitating the conversation in the community so that the community can understand how these two things interrelate. We are trying to show them the risk factors, helping the community to understand that in a household where one caregiver is or overindulges in, let's say, drugs and alcohol abuse, then both the child and the spouse in that family is at risk. We are helping them to understand the underpinning gender and social norms that affect both VAC and VOW. Here what we are trying to show them is that in a patriarchal culture where the father is a total disciplinarian, then both the mother and the child is at risk. We are showing them that both of them, they occur in the same settings, which is the home, and they have compounding effects which flow down now to the next generation. The skillful parenting program that we have seeks to foster a positive, respectful, and equitable family relationship so that we can prevent violence. And we acknowledge that for violence to be prevented, then the community requires an understanding to understand the factors that influence this violence. So we employ a non-confrontational approach for the communities themselves to discuss among themselves and identify the risk factors, identify the challenges, and also to know their strengths and the opportunities which are there across the various levels of the socio-ecological model so that they can prevent violence by themselves. We work with the frontline workers in the communities, which are mostly the child protection volunteers and the lay volunteer counselors. We target parents and caregivers from all types of families, and we mobilize these parents into groups of 18 to 24 members. And one qualification for the parents to be enrolled in the project, they must have a child who is below, or they must have a child or someone who is below 18 years. And they are delivered through local facilitators who undergo a rigorous training on positive parenting, which is the manual that we are talking about. Our manual has 10 modules, which is delivered weekly in 2.5 to 3 hour sessions. And we also mobilize and empower men as caregivers and partners. And what we've learned is that when we embed the gender transformative parenting training on economic strengthening activities, then we are able to mobilize more men into joining the groups. What is displayed now are the various topics that we have. We say that we have 10 topics. The topics, you can see that there are topics that talks about positive parenting, or topic that talks about parenting. For example, roles and responsibility of a skillful parent, child development, early stimulation, and strong attachment. We have topics that talks about child protection, where we are talking about preventing and responding to child abuse and violence. We have topics that addresses issues of GBV in the community, where we are talking about mental health, self-esteem, and self-care. We are talking about values and positive discipline. And we're talking about positive male engagement and balancing power in relationships. Then we also have topics that seeks to empower the households. Here we have topics such as family budgeting. So our gender transformative skillful parenting has undergone a series of evaluation and trials. In 2014, we had an evaluation by University of Utrecht. Between 2015 and 2017, we had the University of Oxford and NMR conducting an RCT. In 2018 and 2019, we had IPA, Innovation Poverty Action, also evaluating the approach. And what they realized, or what came out from the findings, was that, first of all, the gender transformative skillful parenting is culturally acceptable in Kenya, in Tanzania, and in Ivory Coast. Then it has the ability to effectively strengthen gender responsive parenting and caregiving skills. It has the ability to improve family dynamics. It has the ability to promote positive child development, reducing family violence, transforming gender norms at individual and family level, promoting positive gender roles and healthy gender equitable relationships from an early age, and also increasing utilization of essential services and social support. And now to our theme for this year of moving from evidence to practice. We have implemented this program in 11 counties in Kenya, and we've also scaled it up to Tanzania, Uganda, and Cote d'Ivoire. And recently, the skillful parenting has been adapted by government into what is now known as the National Positive Parenting Program, which was launched on May 15th this year. For our next steps and recommendations, first, we are really screaming to everyone that can hear us that gender transformative parenting approach is capable to address both VAC and VAU. And we are calling on the stakeholders for them to invest in training the facilitators and training government officers so that they can effectively roll out this program. We're also calling up our research partners for them to do more research, especially to provide more insights and advance the discourse on how to integrate VAC and VAU via the gender transformative parenting. We are recommending to all stakeholders on the need for layering positive parenting on other programs. We have tried to layer it on agribusiness. We have tried to layer it on issues like VSLA. We have tried to layer it on nutrition programs, and they have all worked very well. Then we are seeking to develop scalable measures to track progress and impact, which is very important for replication and scale. Thank you.
So we have time for questions and answers. You can see one hand up in your hand. Okay.
Thank you. Thank you for your wonderful presentation. I want to ask you two questions. One is, when you're training on parents on positive parenting, do you also include the Children's Act of 2022 so that they should be knowing the children's rights? Two, about the Garissa County. Garissa County has a lot of challenges in terms of child protection. It starts with child marriage, FGM. Do you create awareness to the parent, to caregivers, to men, to children also, so that they know this is harmful cultural practices? Thank you.
Do I take those?
Yes.
Okay. First, about the Children's Act. Now, we have 10 modules in the curriculum, and these modules, they have key messages. But the approach that we're employing in the skillful parenting is that we do not go there to the parents first and also the children. Then secondly, on your issue of Garissa, Garissa is one of the county where the government conducted its pilot, the pilot of the National Positive Parenting Program. And apart from the direct group trainings, we also employ other, we also take advantage of other avenues for us to create awareness. We conduct community dialogues, and in Garissa, the chiefs were trained on positive parenting, and during their chief baraza, they are able now to share the key messages with the community members. Then we also have home visitations. In Garissa, we train the community health volunteers on positive parenting. So when they conduct their routine household visits, they're also able to impart that knowledge to the parents and caregivers at the household level. Thank you.
Thank you very much. And that ends that session. A round of applause for Dennis. So our next presenter, her name is Marcy. Marcy, okay. So Marcy Nyakangi is a researcher. She works as a principal research officer with Kakamega County in Kenya. She has a background in development economics, focusing on developmental issues, and she also works with an organization referred to as Helping Hand for Teen Mothers Initiative. This is an initiative under the First Lady's Office in Kakamega County. Most welcome, Mercy. You have 20 minutes? Go on. Thank you. I come from the land of Ingo, where we love food, and most Kenyans know us for ugali and kuku. So I'm going to greet you, Mlembe, and you say? And you say? Ah, good. I have good. My audience is alert. So you say Mlembe? Bosi. So Mlembe? Good. We didn't take a lot of ugali. I think after my session, we need to go and get some more. So, my name is Mercy Nyakani. I'm from Kakamega County. I'm representing an initiative under the First Lady's Office called The Helping Hand to Teen Mothers. And most of my presentation is a result of what has been presented today since morning, and especially from our keynote speaker this afternoon, Dr. Diana, the effect of sexual violence. Most of it, a higher percentage of it is teen pregnancy. I'm sure in this room maybe we have someone who was going through an abuse when she was a child. In this case, I'm referring to she, because it's teen pregnancy. Maybe you come from a community where this is rampant, or you have a neighbor or your sister has experienced the same. So, violence against children. The end result being teen pregnancy, which is mostly followed by other effects that we're going to see on the presentation. So journey with me along. Most has been discussed, so I won't dwell on that. So we have the statistics. I start with the situational analysis. We have so many data around teen pregnancy. We have like 17 teenage girls give birth globally. And this is as per the World Health Organization report 2022. And 95% of these girls, this data come from developing countries, where Kenya or majority of the African countries lie. So, and remember, statistics don't lie. It means there's something that we need to do. And according to the Kenya Health and Demographic Survey report of last year, we've seen a trend, a declining trend, especially on teen pregnancy, but the trend is still high. So, also according to UNFPA, on average, 20,000 girls give birth every day. Imagine 20,000 girls giving birth every day. So think about those girls giving birth, the effect it has on their education, the society, and all that. When we come close home, 7.2% in Kenya for the ages between 15 to 19 years old experience sexual violence. When we go to closer home, Kakamega, as at last year, 2022 December, close to 13,000 cases of teen pregnant mothers were reported. And Kakamega was among the top counties with high cases of teen pregnancies. After now, we know the northern side of Kenya leads in this, Samburu, West Pokot, but Kakamega also, the western part of Kenya also comes in close. And in fact, we had a recent report by the NTV like 2-3 weeks ago, highlighting this issue in our neighboring county, that is Bungoma County. And the major contributing factor, we have had our speaker since morning say, the huge menace in the room is poverty. Most of these girls come from the rural places where they're very poor. They come from very poor background. When you compare those who come from poor background and the wealthy side, or those who come from well-off families, you find the statistics, there's a discrepancy in the statistics there. As we can see, we have poverty, 21% of the reported cases of teen pregnancy were from very poor background, against 7% cases from wealthy households. And another contributing factor is illiteracy, meaning when a girl is educated, there is less chance of her getting pregnant compared to one that has not been exposed or has not gone to school. So in this case, education acts as a protective measure to teen pregnancy. So we have 38% of the cases who are reported as being pregnant, being with kids who had no access to education, either either primary school, but usually no access to education. And then compared to 5% of cases of kids who had more than secondary school education. So, and then we have the causes. We've heard of the causes. We have defilement, and most of this happens either in the home environment, in society, in school, in the context of the school environment. And then we have the attributable factors, effects. This is just a background to, I'm bringing you close home why we need to tackle teen pregnancy because of these issues. When a girl is pregnant, it's not only the pregnancy, we have the HIV, we have they also experience GBV, the school dropout. They are sold out to marriage at an early age. So we have 99% of the reported cases resulted from either abuse and abuse in another way that is not sexual violence and sexual violence. This is the statistics from Kakamega County. In Kakamega we have 12 sub-counties and 60 wards. More than half of the sub-counties, close to 8 sub-counties, have a prevalence rate of more than 1,000 cases reported within a 5-month period between January to May. So those are the cases. Of course, we can see there is a decline from 2018. We have the cases there, 10 to 14 years, the reported cases are a little bit low compared to 15 to 19 years. So we have a decline trend from around 17,000 to 13,000 last year. So I'm now where we're here. As an initiative, under the First Lady's office, we saw the worrying trend of teen pregnancy. Before we come to teen pregnancy, this child must have passed through something. This child must have been abused in one way or another, And for us to act on it, we had to do something. So that is why we are on the evidence and the preventive responses to violence against children, because we want to reduce the rates of teen pregnancy in the county, make sure that teen mothers are able to go back to school, because most of them, once they get pregnant, it's either they're given pressure to get married off, because it's a shame, and most of them come from poor background. Now, that is why we have a helping hand to Teen Mothers Initiative. This journey started this year in January. We sampled across the 60 wards in the county to get to the most vulnerable teen mothers who acted as champions, who will be champions to the other teen mothers. So we did field work where we went around all the sub-counties in support with the community area administrators who are like village, who work at a community level to identify the teen mothers, those who are most vulnerable within that ward. So these are some of the activities. The first photo that we see here is one of the girls from Malava. We have a sub-county called Malava, which has the highest cases of teen pregnancy. So that lady there, she's called, let me just call her Violet for now. She's a 14-year-old girl, and she was pregnant when she was about to sit for a KCP exams. And after that, she had to drop, but she managed to do a KCP exams. So we can even see behind her the conditions of her surrounding. So you can see, like, if there's no one holding the hand of that girl, the future is over for her. And just imagine how many generations are affected by just that one girl. So some of the activities that we run under the program, we have back to school integration through fee payment, provision of uniforms, dignitary pack for the girls to run them through the year, and also baby nutritional support, so that when they go to school, the child is also taken care of at home. Another thing that we do mentorship programs that cover career development, sexual health education, so that they don't go back. There's always a high tendency that once a guy is pregnant, he's not well educated on sexual matters, there's a high possibility of her going back to the same act and getting another child. We also do advocacy against teen pregnancy, SGBVs, and other child vices. In addition to this, we also hold hygiene or menstrual hygiene campaigns in schools. When we do this, we also involve the boys, because you cannot solve this problem when you focus on the girl child alone. We have to involve the boys. So the boys are also taken through the program. They're also given, when we give the girls the dignitary packs, we also give the boys the boxes. So that is the objective. The main objective of the program is to end teen pregnancy by ensuring that teen mothers are not married off, that teen pregnancy stops with that teenager, that we assist teen mothers to get economically empowered through supporting them in terms of facilitating them back to school, to polytechnics. We also, through this, we are stopping the triple threat in Kakamega County. We are also helping teen mothers through the education system, and we also anticipate to build a TVET training center that incorporates the teen mothers. And this one will help us, once the teens get the vocational skills, those who are not able to go to universities or to college, and they get the vocational skills, like dressing, we are able to support those who are in the school system in uniforms. We mainly have this center, they can do uniforms for them, and there's so many other things. So far the impact that we have had, that was during the launch of the 618 champions. We have taken 8 teen mothers to polytechnics doing those courses, food and beverage, hairdressing. We have 52 who we have integrated back to secondary schools. And through this, we are also able to monitor them. After every time, end of the time, we have a mentorship session with the girls to get to understand how they're doing in school, the challenges that they're facing, and to facilitate them for the holiday. So that is the current program intervention. We have 60 teen mothers. In 2024, that is what we intend to do. The current mentorship program, currently we have reached 2,000 girls and boys through the mentorship program. Next year we intend to do 4,000. We accept teen mothers from early child marriage. Next year we intend to do more than 200. Remember, these are just 60, and we had 13,000 cases in Kakamega County. Those are the challenges, community stigmatization, we've heard about it. Limitation to scope due to financial challenges, because currently the program is funded by well-wishers, and those are the needs for the initiative. Thank you. Together, let's break. Before you clap, I want us to read this together. Let's go. Together, let's break the cycle of teenage pregnancy. Thank you. Thank you very much. A round of applause for Margaret. Mercy, sorry. Was there a question? Wow. Wait. Put your hands up properly, please. 1, 2, we'll only take 5, and we only have 5 hands anyway. So we'll start with you, sir.
Okay, thank you, madam, for the Kakamega County, a very great initiative. We have realized, I'm in child protection sector. I've realized that most of these pregnancies of late, it is what popularly refers Romeo and Juliet. That this boy is 15, this girl is 16. Now, you have said something very good, that you are not leaving the boys out. Most organizations, they concentrate so much on the girl child. They're telling the girl child, tighten your pants, telling the boy child, they don't tell the boy child, zip up your zip. So, what particular program do you have the boys so that they will know they will also be teenager fathers? Whether you like it, they will be teenager fathers. As far as they will not work with the children, but they will be called what? Teenager fathers. What really, how are you addressing this? We need to learn much so that maybe some counts and other areas will, partners will follow out, because in my practice, 10 pregnancies, teenage pregnancies, 7 is children to children. How are you addressing this thing? Thank you.
I'm Mwanajuma. I would like to know, how do you address teenage pregnancy among the people who are, among the girls that are disabled?
Okay, my name is Marvin Lois. My question is about these children who are impregnated by their relatives. When the PS was speaking in the morning, she shared that most of the children are defiled by the people they trust most. And in some tribes, you find that when a girl is impregnated by either the father, the uncle, or the siblings, some of the children are actually referred to as taboo children, and that is how they're rejected in the community. So I would just love to know if there are any of such survivors and how you deal with them. The second one is about girls not being ready to open up when they're impregnated by men or boys. I think it's also on how the society has been judging females, because most of the time you find when a girl gets pregnant, kuna jinsi yanaitwa, yani kwa society, ona huyu alicheza na wanaume, amepata mimba. Is there anything that is done to the culprit, and do we encourage them to speak up? How do we build their esteem to speak up?
My name's I'm Moses, working for So They Can. We are in Nakuru. My question is, I didn't hear the prevention part of it. So what are you doing as an organization to prevent the teenage pregnancies? Are you doing sex education? What are you really doing? My second question is, do you have any intervention for the infants? We may concentrate with the mother, but what happens to the infant who is born, who also have the right to enjoy both parents, as my colleague have indicated?
That's the question, maybe. I'm Cherui. And let me appreciate so much the work which is done by the First Lady of Kakamega County. The issue actually of the teenage pregnancy has been left hanging. That's why when we have even the re-entry policy of teenage mothers to school, that policy has never been revised, and the government doesn't know what to do with those girls. When you look at the policy, there's a lot of discrimination in the policy, but I'm happy to the initiative being taken in this case. And one thing maybe I would like to say, maybe even as you do the mentorship of the girls who have become pregnant and they are going back to school, as you do the whole day mentorship, I was envisaging a situation where even this, as we mentor them, they can also become champions to help the others. That is not, as much as we found ourselves in this, it's not good for you to come this road. By doing that, I think we can be able to bridge the gap which the policy was not able to bridge. Like the policy doesn't allow formation of groups for the mothers. Like when you have a teenage mothers group, it doesn't allow them to form a social organization for them to share their need. But I'm happy at least their children, they're taken care of. That we are even going ahead to think about their children, even so that they can become comfortable in school. And I think that's a very good step, and let me appreciate what you're doing. But above all, can these girls, as you do mentorship for them, can you think of something even, how can they be able to help their sisters who have not fallen to this trap? How can they be of useful to them? I have been this road before, please don't follow me. I've been here, it doesn't seem so good for me. I mean, if you can be able to do that, we can be able actually to achieve what you just told us there. Together, let's break the cycle of teenage pregnancy. Thank you very much.
Mercy, you have 5 minutes to respond kindly. Okay.
Good afternoon. My name is James from Mombasa. Kakamega County, I appreciate what you people are doing so much. Kakamega County was the first county to launch the county child protection policy. So I wanted to know, how are you involved in terms of prevention?
Thank you. My name is Karen. I work in Sanza, Kenya. And my question is, work with communities whereby we do prevention. And in most cases, the parents shares with us that in most cases, when these girls, small girls, drop out of the school, after recognizing that they are pregnant, they just escape from the community and from their family. And now, as the program, what are the measures that you use to bring back these children? Thank you.
5 minutes, Mercy. Thank you for the questions. I'll start with the first one, but he has left. Maybe I'll still answer it for the sake of all of us. How is the program integrating the boy child? I spoke about it. During the menstrual hygiene campaigns, we do these campaigns in school. And so far we have done 8 schools, that is in the second term. Remember, this program started in the first term, or January, towards the end of January. So second term we did 8 schools, a target of 2,000 children. That is both girls and boys in a town, so we were able to reach out to them. And during this menstrual hygiene, when we're doing the campaigns, we involve sex education. During sex education, we also have counselors involved, so that if someone is facing an issue, sometimes they're not able to share, because you may find that even the perpetrators are in school. As we have seen from the statistics, the violation happens at home or in school from the cases that were reported from these girls. So they have a session where they're able to talk to us through our counselors and other professionals that we work with. The second one, teen pregnancy, how we are involving the disabled ones in the teen pregnancy program. Our program does not discriminate. That is why we said we select the most vulnerable. We give them the first opportunity. And in this case, a disabled teen mother is more vulnerable than the one able in a different way. So vulnerability is part of our program, and we address that. But so far we have not, in the cases that we have handled at the county level, we have not gotten any from a disability person or a person that is able differently. I will deal with cases where relatives are the ones who are involved in violating the rights of these kids. When we go to communities, we go to the society, the girls are able to talk to us, because sometimes they're not able to talk to the parents or the uncles or the aunties because of what we come from. Most of us, we come from communities with high stigmatization, especially on this. Tunatakanga kuficha, if it's an angle, we did this. So when they talk to us, we are able, we are linked with the justice system, because we also advocate against the violation. When they are perpetrators, and we have established there's a legal framework to it. So we help the girls go through to get justice. I hope I've answered that. And then in building the esteem of the girls, we talk to them, do sex education, and we do the mentorship programs as I've mentioned. And through those programs, now the team members, I'm combining your question with his question on champions. When I started, I said we selected 61 from each ward within the county to act as champions for the program. So once they go through the program, when we go to communities, sometimes we hold those community meetings. They are the ones who speak to these girls, especially for those who are in polytechnics and those who are in colleges. We go with them when we're speaking to secondary school children during our menstrual hygiene campaigns. prevention of it, we do that through advocacy, and we are involved so much with what happens in the child protection sphere. We are involved in the 16 days of advocacy against violence. There are so many programs that we do in partnership with other entities of like-minded. And as a county, apart from the program, we also have the gender-based violence rescue center that we are coming up with. The girls who may be affected by this, but the community is hostile. So we are coming up with a gender-based violence rescue center. We have one already, that is in the northern side. We already have one in the central side, that is Shinyalu sub-county, and we also have a child rescue center. And we're so much involved with policy work, like the First Lady is championed the domestication of the gender policy to counties. So we have Kakamega County gender-based policy in terms of addressing those. I think I've answered. Oh,
thank you, Marcy. A round of applause for Marcy. So we have come to the end of our session. The other three presenters were not able to make it today. So I want to say thank you very much for being attentive, for being here. And let us take up the challenge of taking care of street children, addressing the drivers and the causes of why children are going to the streets. Why are they getting pregnant? What can we do to prevent this? So, karibuni sana, feel free to depart. Thank you. Who wants to pray for tea? We have tea that you can take as you go home or to your respective hotels. Marcy? Okay. In the morning before lunch break tuliombewa kama watoto, but sasa sahi no tunaombea kama grown-ups. So let's just bow for a word of prayer. Lord, we come before you. We thank you for the sessions that we've had since morning and the speakers who have presented, Almighty Father, Lord, on this topic, Almighty Father. Father, even as we break out 40, we pray that may you bless it and may you bless us even as we go back to our various destinations. And until we meet again tomorrow, we give glory and honor unto you as we spearhead, Almighty Father, to protecting our children. Pray this, believing and trusting in your name.